Hello, this is Dr. David Green, CEO of the Ohio Pain Network. Today's topic is the non-operative treatment of adult scoliosis. Adult scoliosis involves rotation and curvature of the spine due to progressive degeneration. It's very different than pediatric scoliosis. It is typically painful. Adolescent scoliosis usually is not. It's stiff, therefore it's not going to respond to bracing like an adolescent, and it often leads to both back and leg pain due to the arthritis in the spine and that arthritis causing overgrowth and pinching on nerve roots, which can lead to leg pain. Well, why does it occur? There are two reasons. The first is if you have scoliosis as a kid and it goes through adolescence and you become skeletally mature. If it's over 40 degrees, studies show that the curve will usually exacerbate 1 degree per year. Doesn't sound like a lot. But let's say you're 18 years old and your curve is 40 degrees. 50 years later, your curve might be 90 degrees, according to what we see in the research. So that's disconcerting, right? The other reason you can get adult scoliosis is because of spinal degeneration. Spinal degeneration starts in the disc becomes incompetent, and it starts to shift pressures to the back of the spine. So you start to get abnormal motion in the spinal joints called the facet joints. That leads to arthritis. That arthritis is typically not symmetric, so you end up getting a curvature, and you can also get nerves being pinched as a result of the spinal arthritis. Well, what are the symptoms? Well, the arthritis from the facet degeneration leads to significant back pain. Okay, patients may all get muscle weakness and aching from difficulty standing up straight. If you start to get hunched over because of scoliosis, because it's a three-dimensional issue, it can be tough to see the world straight. Okay, you have to look up, and that causes muscle aches and weakness. Also, you can get buttock and leg pain from the spinal stenosis that results with nerve roots getting pinched. Treatments for adult scoliosis, first and foremost, over-the-counter medications, anti-inflammatories and Tylenol. Then, a step up from that is prescription medications, which may include higher strength anti-inflammatories, neuropathic medications such as Neurontin or Lyrica, narcotic medications, and then there's also topical prescription pain creams or patches. Physical therapy can be very beneficial, along with interventional pain procedures. Now, this may include a facet injection. As you can see here, the needle goes right into the facet. All right, these are the joints that are arthritic that can give pain relief for weeks to months. Trigger point injections, which are injections that go really back up in here in the soft tissue, can help a lot with the spasms and weakness and aching. Additional treatments may include a medial branch block. In the top area here, you see spinal joints on either side. These little nerve roots are the roots not the nerve root, these little nerve endings, are the ones that provide sensation to these joints. They don't have any motor function, okay? Injecting around these little nerve endings can provide immense pain relief, and that can last for weeks to months at a time, okay? Now, if that works and then wears off, you can either repeat it or move on to what you see here, which is where you have a catheter in around the same area, heats up and deadens those nerve endings. That can provide pain relief for anywhere from 6 months up to 2 years. It's amazing. That's called a radiofrequency ablation. And then if you have pinched nerves, an epidural steroid injection can work very well, and that can either be done, there's about 3 different ways to do it, but that can provide incredible relief for that buttock and thigh and leg pain from nerve roots getting pinched. What are the outcomes with non-operative treatment? Over 90% of those with adult scoliosis can achieve a satisfactory level of baseline pain without surgery. Most patients don't end up needing surgery. It's an elective quality of life procedure that should be a last resort. Surgery is going to involve decompression of the nerves that are being pinched along with fusion of a significant amount of levels. Very high complication rates, over 50%. This is going to be anything from some slight wound drainage up to a blood clot with a pulmonary embolus, anything from hardware breaking. And the rehab for these procedures is anywhere from 6 to 12 months. Adults simply do not tolerate scoliosis procedures like you do when you're an adolescent. The top non-operative pain management in Ohio is through the Ohio Pain Network. There are several clinics accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning doctors. Visit us online today at ohiopainnetwork.com and then call us for more information and scheduling at 888-466-9898. I'm Dr. David Green with the Ohio Pain Network. Your pain stops here.